Hey, so my student today asked me to make a video about thumbs. And she said that her thumb was hurting and she called it the doom scrolling thumb. And I thought that was pretty creative and amazing. So I decided to make a video on thumbs alone. We are using our thumbs so much and in a way that our bodies aren't really accustomed to using. So here's your phone, right? And so we're doing this motion. Here's my dog, and then my dog is right there. Desi, her name is Desi. So we're using our thumbs, we're using them this way and that way. And our thumbs are actually different than our fingers, as you know, because they have this circular joint movement that our fingers don't have the flexibility like our thumbs. But because we are repeating this movement, super repetitive, scrolling on your phone, not only are we moving the thumb in, adduction, but we're also moving the thumb out, abduction. So you're getting tightness in here, overuse and tightness in here, and then overuse and tightness here. And then it kind of jams the joint down, or your thumbs just might not feel good. So we're going to do a sequence today to work on that, and also something that you can do nightly. And one more thing before I begin it, if you can actually prevent that in your thumbs once in a while and just put your phone on a countertop and type like you're, in first grade, except my second grader types better than that. Like, he's a much better typer than me. That's just an aside, but you know what I mean? So you're not using your thumbs, and just actually use your arm and keep the fingers neutral rather than using your thumb. So take a break once in a while, just to reminder, so you don't get that repetitive stress injury. Our thumbs get arthritis quicker than a lot of other joints in our body. So take care of our thumbs. We need our thumbs. We got to pull our pants up. Okay, and take our pants down, but mostly pulling your pants up, you're using your thumb. So we're going to start with this thumb. So I'm on my right hand here, and you're going to grab your thumb base and then just do a circular motion. So we're just circumventing the joint. So we're just mobilizing the joint there, and then circle the other way. Okay, just again, getting some of that synovial fluid pumping. And then what I'm going to have you do is you can put a finger or your other thumb in, and you're going to squeeze your thumb to thumb. Okay, hold it for 5, 4, 3, 2, 1. Okay, you're going to release. We're going to do the other direction. So you're going to abduct the thumb, add a little pressure with your other fingers there, and then hold. 2, 3, 4, 5, and release. You can do that back and forth, especially if your thumb is really sore. But what we're going to do now is we're going to take our thumb and fingers right at the soft tissue, right where we squeezed, and you're just going to massage it, just going to squeeze into it, move the soft tissue around. And I noticed that on my right thumb, it's a lot thicker than my left thumb. I'm right-handed. I use my thumb a lot more in this hand. That makes perfect sense. But you'll feel that it's really tight, and you might even get some sensations down your fingers, but I find that really interesting. It feels really good. And then after we massage it, we're going to take it into a stretch. So how I do my stretch is I make a 90-degree angle, and I actually grab my thumb and I pull it back a little bit. You don't want to force it. That's not good. You just want to pull it back to get a stretch right here in the adductors. Okay, release. And then we're going to take our other thumb and just massage up the side of your thumb that reaches out like that, right? So this tendon right in here. I'm going to go transverse to the tissue. So I'm going side to side or east to west. Yeah, all the way down. You're going to feel this bone right here. Okay. And then we're going to take this into a stretch. So I'm going to grab my thumb with my other fingers and then point the wrist down. See that? This is actually a test for De-Quervain syndrome, which can be like, get really sore in the wrist, overusage, repetitive stress injury. So if you have quite a big amount of pain when you do this, that's kind of a red flag. So I would see your doctor about that. You don't want to overstretch it, or, this is just good information if you have a thumb that's really overused. I've had a couple friends that had De-Quervain syndrome and had to have surgery. Good, and then release. That's it. And I'll just quickly do the other side so we can memorize it. It's your homework. You're going to memorize this. We're going to circle the thumb, circular movement, releasing that synovial fluid. Okay, and circle the other way. Good. And then we're going to take our thumb inside. We're going to squeeze 2, 3, 4, 5. We release. Press outward 2, 3, 4, 5, and release. We're going to dig in and massage this web, the thumb web, right? We want to go all the way down towards the wrist part. So towards these bones of your hands, we're getting right in that soft tissue. It's going to feel thick. It's going to feel sore. You're going to be like, whoa, I didn't realize it was that sore. Maybe you did, who knows? Okay, then we'll stretch it. So take that 90-degree angle, pull it back a little bit. I'm grabbing my whole thumb and the heel of the thumb so I can get a good purchase there and pull down and stretch. And I'm reaching my fingers away. Good. And release. And then we're going to get transverse to the tissue on the side of the thumb there. I'm going to massage it and work my way down. It's actually a lot more sore on my right hand. Knew that. Use my right thumb a lot more. And our stretch, grab your thumb with your fingers and then kind of angle your fist down, stretching here. Okay, your tendon that abducts the thumb. Hold. Good. And then we just wash, rinse, and repeat. So this is actually a great sequence to do daily, especially if you find yourself on your phone all the time, like we all are. Obviously, I'm going to say try to give yourself a break on the phone. And if you can't, put it on a countertop and then type on it and use your arms instead of using your thumbs. Give your thumbs a break. They need it. All right. Well, I hope you enjoyed this video and I hope that you can continue to do this daily or once a week. I'd be happy with once a week. Report back. Let me know how your thumbs feel afterwards. Okay. Thanks for stopping by.